But what many people don't realize is that migraine can actually cause neck pain. And what we've basically found in our research is that there's quite a few people who have neck pain but have nothing wrong with their necks, which means that the neck pain is entirely part of the migraine. It's one of the migraine symptoms. Trigeminal cervical nucleus is basically an area in the brain stem, so at the base of the brain, basically, where the nerves converge. So it's a congregation of nerves from your neck, from your head, and your face. So all these nerves that send messages from your neck, face, and head will meet within this complex. And then from there, a second set of nerves send the messages up to the rest of your brain. So if you're thinking about it, it's like two teams, right? The first team is sending messages to this complex, and then the second team sends messages up to the brain. So what then happens is that sometimes the second set of messages getting sent up to the brain gets a bit mixed up. Is it coming from the neck? Is it coming from the brain, the head? And vice versa. So if you have nerves sending nociceptive or painful messages from the head or face, and it goes to that complex, and then from there the message goes up to the brain, but the brain is not sure, then it might think that the message is coming from the neck as well. So then you start to get pain not just from the head and face, but you also feel it in the neck. So basically this complex explains why people with migraine can get neck pain that's entirely referred from the migraine. It's got nothing to do with the neck. So in that patient who was so surprised that they have nothing wrong with the neck, they went on the correct preventative medication, which brought down the migraine sensitization and the migraine mechanisms that was working all the time. And the neck pain went away. And then they were convinced that, oh, I see what you mean now. It's entirely referred from migraine and there's nothing wrong with my neck. So you're right, getting on the correct medication is really, really crucial.